Hey friends, today we are going to talk about a very important disease, the hyperlipoproteinemias. It's very common and very important. It do come in the exams in the biochemistry, and we should know it to score better in an exam. So the main aim of this video is to about knowing the disease in a very concise manner, in a crisp manner, and produce it in the exam. Okay, first we're going to talk about the classification. The Fredrickson classification is a very simple one, and I'm sure you will learn it very quick manner. Okay, the hyperlipoproteinemias can be divided to the primary, and the secondary. Okay, mainly the primary hyperlipoproteinemias is divided by Fredrickson classification into mainly three groups: the first group, the second, and the third. The type 1, then type 2, and then type 3. The core of the disease is whether it is the triglycerides which are increasing or the cholesterol which are increasing. So we have to know that whether it is the triglyceride, cholesterol, or both. Very simple. The first one, here there is increase in triglycerides, and in the second one there is increase in the cholesterols, and in the third part, simple, both are increased, the TGs and the cholesterols. So it's very same, and there's also another 4 and 5 type which simply relates to the triglycerides. Okay, the first one is increase in triglycerides, then the cholesterol, and the third type is about the increase in both triglycerides and cholesterol. First, we are coming to the first type 1 hyperlipoproteinemia, which is also known as the familial hyperlipopoteinemia. Then, first, the inheritance pattern. I will teach you in a very crisp manner which group of type 1, type 2, type 3, and which one has which inheritance. Okay, let's come here. The type 2, type 3, type 2, and type 3. The first one is autosomal recessive, second one is autosomal dominant, then the third one is again autosomal recessive. So it's very easy to remember like this. Okay, so there the autosomal recessive. In the name we itself know that there is a increase in chylomicronemias, and here the defect lies in an enzyme known as lipoprotein lipase. Write down here the lipoprotein lipase, or there is a defect in ApoC2. This is a molecule which actually regulate the LPL function. So whether it is defect in LPL, the lipoprotein lipase, or ApoC2, it will result in the type 1 hyperlipoproteinemia. Okay, here there is accumulation as you can know this from the name. There is chylomicronemias, which will eventually result in the clinical feature of milky white plasma, and then the chylomicronemias can associated with increase in mature VLDL, and the lipoprotein that is increased, as you can say from there is triglyceridemia. So lipoprotein that is increased is triglycerides, which can result in acute abdominal pain. And there's also two more associated things with here. In all the lipoproteinemias, you can see the xanthomas. Here, the type of xanthoma, there is three types mainly: the eruptive type, the tuberous type, or there is another type, tuberoeruptive type. Here, the xanthomas are eruptive type of xanthomas. Okay, we'll see the picture here, and there is a fundoscopy. If you do a fundoscopy, you can see the lipemia retinalis. Here you can see the images. Here this is, you can know this is a milky white plasma. Here you can see the lipemia retinalis, and here this is, you can see the knee joint, the skin over the knee joint showing the xanthoma, the typical eruptive xanthomas. Okay, we'll compare it with another lipoproteinemias. Here there's a very shortly the treatment part. There is an enzyme therapy. Actually, this is an enzyme therapy, the A-liposen Tiparvec. This is actually used in higher centers to treat type 1 hyperlipoproteinemias. Okay, this is all about the type 1. Next we come to type 2 hyperlipoproteinemias. Type 2, as you can see here, we discussed this. Type 1 is AR, type is AD, then type AR. So this is all about autosomal dominant behavior. It is actually of two types, 2A, another is 2B. The A is due to the mutation in LDL receptor mutation. Actually it can be defect or absent, whichever it may be. And the type B is type B for ApoB, and this ApoB 100. You can remember like this. The type 2B comes B, ApoB and 100. So in the first one we see that this increase in triglycerides. So in the second, eventually it is the cholesterol which are increasing in the type 2. So type 2, there is an accumulation of cholesterols. In type 2A, actually there is LDL and cholesterol increasing, but in type 2B, along with LDL and cholesterol, this VLDL is also increasing. Okay, so as cholesterol is, you can see that there will be atherosclerosis. You know that increase in cholesterol eventually leads to atherosclerosis, but here it will be in age less than 20 years, means there is premature atherosclerosis here. Okay, this premature atherosclerosis. And in the type 1 you can see the plasma is milky. So here the plasma is clear because chylomicronemia are not here, they are not increased. And in every lipoprotein you will see a xanthomas, and the type of xanthomas we can see here is tendon xanthomas. We'll see the image. Okay, we'll first see the image. That is the tendon xanthomas. You can see here. It is mainly present in the most common joint to involve is the actual tendon to involve is the tendon Achilles. Here you can also see, and this is the classical arcus senilis. The fundoscopy finding here, there we can see that the lepema retinalis in the type 1 here, but in type 2 we will see the eye finding. Here will be the corneal arcus. As you can see there, this is the corneal arcus. This is all about the type 2. Here the treatment will be with mipomorphin or the glomipatide. You can try to remember this, not so important, but may become in the high institute exams. Okay, then we will come to the type 3 lipoproteinemia. This is important type 3 lipoproteinemias, and this exactly you can see that there is a 3. So 3 means we can see another E and then ApoE defect. This is all about ApoE defect. This is also known as the familial dysbeta lipoproteinemia, remnant removal disease, or the broad beta disease, because it can result in increasing both TGs and cholesterols increasing. So it is broad beta disease. We learned that it is due to ApoE defect, broad beta disease. Here there will be rise in TGs and cholesterol both. So we can say that it can result in again xanthomas, but what type of xanthomas here? It will be of both TGs and cholesterol. So you can say that you can combine 1 and 2 and simply say that tubero-eruptive xanthomas. There will be again palmar xanthomas, again including the other xanthomas, and there will be again cholesterol increasing, so increased risk of coronary artery diseases. There will be increased risk for coronary artery disease. Let's see the images here. You can see here this is a palm, so and there is a yellowish line there, and it says the palmar xanthomas. And here you can say this is both tubular type or eruptive type, which is known as tubular eruptive xanthomas. So this is all about the major type 1, 2, 3. You can simply remember like that. The TGs are increasing 1, 2 and 2. Cholesterols are increasing in type 3. The both TGs and cholesterol increasing. Here the autosomal recessive, autosomal dominant, autosomal recessive, like that you can remember. Also there is the first step, there is milky white plasma, the acute abdominal pain, the eruptive type of xanthoma, the lipemia retinalis. You can see the images here. Just in few minutes, if you have exam tomorrow or the day after tomorrow, you can just revise it in 3 or 4 minutes, and you will surely get the marks in the exam. But it's just simply remembering this. So this is all about today. Thank you for watching the video, and we'll soon meet in written